Welcome to This Explainer. Today, we're diving into a men's health topic that honestly carries way too much stigma, even though it's incredibly common and, more importantly, very treatable. We're talking about Peyronie's disease. We're going to take a clear, step-by-step clinical look at the science behind it. Think of this almost like a modern medical documentary unfolding right in front of you. We'll explore exactly what happens inside the body, why it happens in the first place, and the really advanced treatments available today. Okay, let's dive right in. So, is a curve normal? It's a question a lot of guys quietly ask themselves when looking in the mirror. The short answer? Well, a lot of men naturally have a slight curve to their erections. If you've had it your whole life, it's usually absolutely nothing to worry about. But if you're noticing a sudden new bend, maybe a change in shape, or especially if you're experiencing pain, I really want to validate your anxiety right now. You are definitely not alone in noticing these changes. And as we'll see, it's just your body's way of telling you that a very specific mechanical process is happening beneath the skin. Section 1. The unspoken health issue. The reality here is that a staggering number of men simply suffer in silence with this. Because it involves changes to a very private part of the body, men feel embarrassed. They might assume it's just a normal part of getting older, or worse, they mistakenly think absolutely nothing can be done to fix it. But the sheer scale of this condition, it's huge. Officially, medical data shows about 1 in 100 men in the US are diagnosed with Peyronie's disease. However, when you look at broad clinical studies and patient surveys, experts actually estimate that up to 1 in 10 men have the condition. To put that in perspective, if you're dealing with this, you are literally in the company of millions of other guys. It's incredibly common, it's just heavily underreported because of that stigma. And man, that silence takes a massive toll. Take a look at this finding from Yale Medicine. Up to 50% of people with this disease have some level of depression. Peyronie's disease isn't just a physical change, right? It carries a huge psychological and relationship burden. We're talking anxiety, loss of self-esteem, fear of intimacy. I want you to know right off the bat that this is a serious, recognized medical health issue. It is absolutely not a personal failing. Section 2. Understanding Peyronie's disease. Let's pull back the curtain on the actual clinical science here. By understanding exactly what's happening anatomically, we can strip away all that stigma and see Peyronies for what it truly is, just a mechanical, structural issue in the body's healing process. If we were to look at a high-end 3D medical illustration of the internal anatomy, we'd want to focus on something called the tunica albuginea. This is a thick, super elastic membrane inside the penis that helps keep it stiff during an erection. In Peyronie's disease, fibrous scar tissue, which doctors call plaque, builds up right inside this elastic membrane. Now, it is absolutely crucial to understand that this plaque is completely benign. No way is it a tumor, it is not cancer. But because scar tissue doesn't stretch, as the penis expands, this rigid plaque pulls and tugs on those elastic tissues around it, and that is exactly what creates that painful curve or bend. So what does this actually look and feel like physically? Well, the main symptoms you might experience include a noticeable new bend or curve, and that could point upward, downward, or off to the side. You might actually feel a hard lump right under the skin. It often causes painful erections, especially in the early days. You could also notice a shortening of the overall length, or even a weird narrowing effect that gives the shaft kind of an hourglass indentation. It's really important to note here that if you just ignore it, severe curvature can eventually make intercourse impossible and lead to complete erectile dysfunction. Section 3. The 2 distinct phases. Here's the really crucial thing. This condition is not static, it evolves, and timing is quite literally everything when it comes to treatment, because the disease behaves completely differently depending on how long you've actually had it. Doctors break this down into the acute phase and the chronic phase. The acute phase is that active beginning stage. It lasts anywhere from 3 to 18 months. During this window, the scar tissue is actively forming. You've got inflammation, the curve is dynamically changing, often getting worse, and this is when pain during erections is definitely most common. Then it shifts into the chronic phase. This is when the plaque solidifies and stops growing. The curve essentially stabilizes and that active pain usually subsides. But the physical bend and structural rigidity, those stick around. So your doctor needs to know exactly which phase you're in to recommend the right therapy. Section 4. Causes and risk factors. Now that we know what it is, let's explore exactly why the scarring happens in the first place. And right off the bat, let's just bust a huge myth. Peyronie's disease is not an STI, and it is absolutely 100% non-contagious. The medical community largely agrees that it's the result of abnormal healing from micro-injuries. Picture your body's natural healing process, but just stuck in overdrive. Everyday vigorous sexual activities, athletic sports, or even minor bumps can cause tiny, unnoticed tears in that internal elastic membrane. For most guys, these just heal up perfectly. But in men with Peyronies, the body totally overreacts. It overproduces heavy, rigid scar tissue right at the site of that tiny little injury. So why do some guys overheal like this while others don't? Well, it comes down to a few key risk factors. Age is a big one. It's most common in men between 40 and 70 because, tissue elasticity changes as we get older. Genetics also play a role. If your dad or brother has it, you're definitely at a higher risk. Interestingly, men with diabetes who already suffer from erectile dysfunction are 4 to 5 times more likely to develop it. And get this, overlapping connective tissue disorders are a major red flag. For example, Dupuytren's contracture, which is a condition that causes similar tight scarring but in the palm of the hand, shares a really strong clinical link with Peyronies. Section 5. Diagnosis and finding support. Okay, let's shift gears toward taking action. Knowing the mechanics is great, but getting professional help is how you actually get your life back. Imagine walking into a bright, modern urology clinic. It's really not something to fear at all. It's just your first step toward a solution. The diagnostic process is super straightforward, highly clinical, and totally non-scary. It starts with a simple medical history, just talking through when the symptoms started and how they're affecting your life. Next step is a gentle physical examination, where a urologist can usually just feel that hardened plaque right through the skin. Finally, and this is where amazing modern tech comes in, they might use a Doppler ultrasound. This high-tech scan maps the exact size and location of the plaque and checks the blood flow, essentially giving the doctor a perfect blueprint for your treatment. But of course, you actually have to walk through those clinic doors first. UT Southwestern Medical Center hits the nail on the head here. Embarrassment or perceived lack of options may cause many men to avoid seeking care. If you take away just one fact from this explainer, make it this: silence is the biggest barrier to your recovery. Avoiding the doctor while you're in that acute phase just allows the curvature to worsen, which can potentially result in permanent loss of length or function. You've got to drop the shame. Section 6. Modern treatments and hope. And there's honestly so much reason for hope here because we're living in an era of incredible medical advancement. Let's look at the highly effective modern medical treatments available today that can restore both function and your confidence. Your options generally fall into two distinct paths: non-surgical and surgical. Early on in that acute phase, doctors rely on conservative therapies. We're talking mechanical traction devices, which gently and consistently stretch the tissue, and intralesional injections. Doctors can inject medications like verapamil, interferon, or collagenase directly into the plaque to literally break down the scar tissue. Now, if the disease is in the chronic stable phase and the curve is severe, definitive surgical options are highly successful. These range from penile plication, where they basically pinch the opposite side to straighten it out, to grafting out the scar tissue entirely, or even placing concealed penile implants if a patient is also dealing with severe erectile dysfunction. Let's highlight a truly incredible breakthrough here. 30. That's 30 degrees. There are FDA-approved enzyme injections, specifically a drug called Xiaflex, that are targeted directly at men with a curve greater than 30 degrees. This medication literally dissolves the collagen that makes up the scar tissue. It's a perfect example of just how targeted and precise modern medicine has become for this specific condition. Now, I do want to be totally real with you. Treatment takes time. Reversing or breaking down hardened plaque is a complex biological process. It requires weeks, sometimes months, of consistent therapy, injections, or healing up from surgery. But the data is crystal clear. Seeking help early, rather than just waiting for the pain to go away on its own, absolutely maximizes your chances of maintaining a completely full, healthy sex life. So that brings us to our final question. Are you ready to step out of the silence? You know the science now. You know it's a mechanical issue of scar tissue, not some reflection of your masculinity. You know that modern clinics have the tools, the ultrasounds, and the targeted treatments to actually help you. It is time to drop the shame, have an open conversation with your partner, and go schedule a consultation with a urologist. If millions of other men are going through this exact same thing, why on earth should you let a treatable, mechanical issue dictate the rest of your life in silence?